Hello and welcome to Seven Sentinels. This is Grand Master class and I'm Peter Simon with you. Today we are conducting speaking sessions and we have with us Preeti Sehrawat from India. She is a nurse by profession and she is preparing for nursing specific occupational English test. Yes, Preeti, once you are ready, you can start. Hello, Preeti. Hello. Hello. Hello, Preeti. Yes. Are you able to speak? Hello? Your voice, I think it's removed headphone. I cannot hear anything.
No. Hello?
Yeah, now I can hear. Okay, that's fine. Okay, right.
Okay.
One second. Same like yesterday. You don't make any modifications. Okay. Yeah, let me.
Sir.
Hello and welcome to Seven Sentinels. This is Grandmaster class and I'm Peter Simon with you. Today we are conducting speaking sessions and we have here with us Preeti Sehrawat from India. Yes, you can start once you are ready, Preeti.
Yes, I'm ready. Actually prepared that. May I?
Yes, you can start.
Okay. Good morning.
Good morning, nurse.
My name is Preeti and I am one of the registered nurses working in this medical clinic. So can you please tell me how can I address you?
Yeah, you can call me Lincoln because my name is Mr. Abraham Lincoln. You can call me Mr. Lincoln and I am 60 years old. I have come here regarding insulin injections, counseling or education.
Awesome. Okay, Mr. Linden. Myself, Preeti, as I mentioned you, that I am one of the registered nurses working in this medical clinic. As your doctor wants to start your insulin injection, so he made your appointment with me, right?
Yeah, of
Can
course,
you please
nurse,
tell
you're
me?
absolutely right.
Can you please tell me about what you feel about insulin injection?
Yeah, actually, I have been managing my diabetes for the last 4 years with my medication regimen, dietary measures, and exercise program. And why then is the doctor suggesting me to change my treatment plan?
I'm little bit, yeah, Mr. Linden, I can understand your concern, but could you please tell me about what is your reason of your anxiety?
Yeah, actually, I don't know. Why should I go for these injections? Can I not continue my oral medication?
I don't worry. I am here for you, and I will guide you with this clear instructions. So don't be worried about that. And you are at right place. Firstly, I can understand your concern, Mr. Linden. So, say the doctor advise you that your doctors advise you on your convert your medication to insulin injection because of your insulin level is unable to control with the all medication. That is why that doctors advise you, and that insulin are better option as your compared to your all medication. Okay, Mr. Linden.
Yes, of course, nurse. I think actually, is there no other way to manage my sugar levels? Because I'm not a nurse, and I'm a little bit scared of self-injecting insulin.
Yeah, Mr. Linden, don't be worried about that. I will tell you how to take that insulin injection. But firstly, I would like to ask you some question. May I?
Yeah, of course, nurse. Please ask me. I'm ready to
Uh,
answer.
Mr. Linden, can you please tell me about why are you anxious about your why are you anxious for this reason?
Yes, yes, of course. I am very anxious because of various reasons. And then, if anything goes wrong, if there are any side effects, then what am I supposed to do?
That Mr. Linden, that first of all thing that I will let you know, I will tell you that that insulin injection is it is not painful injection, and you can easily take that injection with the by yourself. And if you have any concern that about you are worried about your that injection will be harm on your tummy, harm on your stomach, then you can ask me.
Okay. So what are the various places where I can take the injection, and what type of needles should I use, and should I use the same needles and syringes every day, or should I replace them with your new ones?
Yes, Mr. Linden. That first of all thing you can that insulin you have to take that insulin injection. Firstly, I will tell you that firstly you can wash your hand and dry it. After that, you can pinch your site, and you can insert your insulin syringe at 45 to 90-degree angle. After that, you can hold that insulin injection with the needle at least 5 to 10 seconds. After that, you can remove it and make sure that you can save your needle. Okay, Mr. Linden? And
Yeah,
there are lots
that's
of chances to another person prick that in syringe, and he will get another disease from your syringe. Okay,
okay,
and
nurse.
you can use your site on the you can change your insulin site that sorry you can change your site by alternative days, because if you are taking the same site on insulin injection, and you can maybe you can see another lump on that side, and like bluish color also, and this kind of that's why I'm saying that you can divert your site. Okay.
Okay, nurse.
And one
Uh,
more thing I would like to tell you, that you can dispose your syringe at the another container, rather than to on direct dispose on the dustbin. Okay. And
okay,
before taking that injection, you can check your expiry date of insulin vial, and that vial will be keep on the refrigerator also at your home place. Okay.
okay, that's fine, nurse. That's the information is very clear, and I understand everything. So that sounds good, and I feel better about the injections now.
Okay. And Mr. Linden, do you have any query rather than, I mean, do you have any other question?
Okay, what should I do with these used needles and syringes? Can you please tell me?
Sorry?
What should I do with these used needles and syringes? How should I dispose them off?
That's as I mentioned you that you can dispose your syringe at this small and simple container, and that container will be covered by with the cap, and you do not dispose the syringe at the direct to the dustbin, because it will get another person will prick that, and he will get any who will get any another disease like HIV, HCV, these kind of things.
Okay, nurse.
Okay.
So thank you very much for the valuable information. I am ready to go for self-injecting insulin, and I want you to watch me while I give myself in injection.
Sure, sir. And one more thing I would like to tell you, I hope so I clear your all doubts. If you have any other concern, please let me know. I'm here for you.
Thank you very much, nurse.
Thank you.
Yeah. So coming to the point, now we'll have some feedback regarding the session. Yeah, you have done well. This is your first speaking session. I know there are some times you lagged behind or something mistakes you have, some mistakes you have done. That's not a big problem, but still till the end you have stood or sat down. You sat down and completed the speaking session. That's more important. So today I will tell you about some important things. Every day I'll give you some points. All of them I cannot give on one day. So gradually you can learn how to use this. For example, you are telling I many times. So that means the importance is shifted to you rather than to the patient. That means you are proving that you are great. You are boasting that you are special. You are thinking that you are more important. If not you, there are many other people. Anybody can do this one. So what is special about you? Why you are focusing on yourself more rather than the patient? That's my question. So I will do it. I will give you medication. I will help you. I will teach you. I will educate you. I will explain you. Why this I is coming so many times? Okay, how can I speak without I, sir? You may be asking me. Yeah, you can speak. Explanation will be provided. Information will be given. Suggestions will be provided.
Okay.
Prescription. Okay, medications will be prescribed.
Okay.
Education will be offered. The procedure will be explained. Finished. I will explain you the procedure. Why anybody can do that. Is that clear? This is what is quality. This is the reason why many people fail in the exam. You understand? They don't know. Simply they are putting I 10 times, you 10 times, he 10 times. What is the use of all these things? Without them also we can. That is called quality. Eliminating the unwanted material and using. Because you are a nurse. Any nurse can do that one. Then what is so special about you? Why are you putting yourself this importance? That is my question. So avoid this I as far as possible. Until and unless there is a compulsion, don't use it. Number two, don't be worry about that. Don't be worry about that. Why be? Don't worry about that. There is no need to be. Okay. Otherwise, you have to say, don't be worried. Don't be worried. But that is not needed. Don't worry is enough. Okay. Don't worry is enough. Next, this don't worry about that. You repeated. Not one time, 2 times you have done it. And as you got stuck here and there, and you're saying as you're repeating the word. Then next, Mr. Lincoln. You have said Mr. Lincoln almost 7 to 8 times. I don't remember exactly, but you have used a number of times. What's the reason for repeating this name so many times? What is the use? Is that of any use? Practical benefit? Definitely no. Because are you memorizing my name, or are you gaining any benefit from that? No. Am I gaining any benefit from that? No. I know that I am Mr. Lincoln. So why should you tell me Mr. Lincoln time and again? So no need. Then firstly, this you have used 2 or 3 times. Firstly. So one time only use, or initially, to commence with, to start with, to begin with. Any other word you can take. Now, why firstly? So no need repetition. Then you're saying you should do this, you should do this, you can pinch the skin, you can. Why this? Firstly.
So this is my first time. I will try it.
No, you will do it. You are doing fine. There is no problem. That they are not mistakes. They are not mistakes. The sentences are correct. You should pinch the skin. Correct only. I'm not telling it is wrong. It is correct only. But the quality is not fine. The quality is not fine. See, once you take curd is very thick. If you pour water, the more water you put, the less tastier it is. You understand?
Yes.
You prepare curry. You prepare a curry, and without water you put, it's very tasty, delicious. But once you put water in that one, the taste will be off.
Mhm.
More water you put, the less tastier it is. Correct?
Yes.
So you are putting water into your curries, and it doesn't taste fine. So avoid all these things as far as possible. And what you can do is you can write some sentences and send them to me, and I will correct them, and then you can practice, and you can listen to others audios also. So there are
Yes.
four things here. First, there are three things here I want to tell you. First one is grammar. So grammar is very important. You get marks for correct grammar. If grammar is wrong grammar, you will be getting less marks, scoring less. Then next one is vocabulary. Vocabulary, use excellent vocabulary. Avoid ordinary vocabulary which everyone can speak. The next one, pronunciation. Try to pronounce properly. Repeat the native speakers' audios. Repeat the native speakers' audios.
Okay.
The next one is fluency. Fluency means the flow of speech, how well you are speaking, continuity of speaking, not very fast. See, I'm also speaking, but I'm speaking fluently. I'm not speaking very fast. I'm sometimes speaking very slow also, but there is fluency that is maintained because word after word after word, it is just flowing. Next one. Lastly, fluency. Then accuracy. Accuracy means correctness. This accuracy is related to three different things. One is vocabulary, one is grammar, and one is pronunciation. Accuracy. So the next one, last one is the presentation, overall presentation. The message is clearly understood by the other person or not. So that is very, very important. If all the information you have provided, that's enough. You don't need to focus much on medicine and medical language, but you can to focus more on English. Linguistic is more important thing. Right. So now I'm giving you 1 minute. You can speak whatever you want. You can share your experience.
In my own words, that warm-up question like that.
No. Your opinion, your feedback regarding what you learned today, how the session is, did it give you benefit? Sir gave you proper
I,
feedback or not? What knowledge you gained? How this session was beneficial? This is recorded live, so you can see afterwards and you can know what is happening, why you are tensed, why you are upset, your feelings, your expressions. You can see on your YouTube. Then you can understand what is your problem. You can understand. If it is not recorded, you will not know. So all these things, what is
okay.
the benefit with this session to you? That I want to know.
Okay. Firstly, thanks to you, sir, that you gave me this opportunity to conduct my interview. And one more thing, I know about my lots of mistakes. Just like you mentioned me that I would repeat my I words again and again. I skip that word and I use that different type of words, just like support and provide, just like that. Second, my mistake was that I used your name, that patient name, and I can avoid that because that patient knows that you are a patient name, and I also know that. Then why I am repeating again and again? This is my second mistake, and I know that how to cut that mistake. And that third time I made a mistake that I'm stuck that particular word, that so, and that avoid that mistake. And my fourth was I noticed that mistake that use firstly again and again. And rather than use that word, I use these either initially, this type of word, secondly, moreover, this type of word. I will use that and avoid that, and I use the particular qualities and my profession and my fluency and my vocabularies. I will improve my speaking skills, and this kind of, and my overall experience was amazing, and I gained lots of knowledge by yourself, and you can teach me very well, and I'm very happy for that. I'm so glad you are teaching me.
Yeah, thank you for your feedback. Now you use the sentence, I am using these words again and again. So
Yeah.
again and again, you can use the word repetition.
Okay. Yeah.
R-E-P-E-T-I-T-I-O-N, repetition. R-E-P-E-T-I-T-I-O-N, repetition. So avoiding, I will avoid repetition.
Patience.
Or repetition will be avoided in the future. Finish.
Okay.
So you are telling, I am telling again and again. So quality word, repetition is a very good word. Today you learned a new word. Like this, use such good words. Anybody can say again and again, but repetition is a special word. So not
And
everyone, 1 in 100 or maybe 1 in 1,000 can use the word repetition. Yes or no?
Yes, sir.
So that makes you awesome. So are you ready to learn like this? Do you like this type of feedback, or do you want ordinary feedback like how everyone else is giving?
No, sir. I'm taking that your feedback, and you teach me one more word that, as I mentioned you before, that you taught me that after considering all the possible manners, this is more important word. I taught that, and it is this word will also help me in the future.
Yeah, it's a phrase. It's a phrase, not
It's a
word.
phrase.
It's a
Okay.
phrase,
Okay.
means part of a sentence. Part of a sentence. It's not one word, it's a part of the sentence. After considering all the possible measures, the doctor has finally suggested self-injecting insulin. Finished.
Injection.
See the quality of the sentence.
Okay, sir.
After carefully considering all the possible measures, self-injecting insulin is recommended, means by the doctor only. Doctor, no need to say doctor. Doctor only will recommend, na? Correct?
Yes, sir.
So what is recommended is important. Who recommended is not important, is already understood. Only authority, people with authority can recommend. So no need to say doctor, nurse, everything, because patient is important. Self-injecting is important. That's all. So this is how you go. Yeah. So that is the end of the session for today, and we'll call it the close of this session. And we're coming up with another session shortly. And before that, I want to tell the viewers on the YouTube and other channels, whoever is interested in our sessions, you can subscribe to our classes, and you can register and you can get the regular session. This is just a part of the story. This is not the entire story. There is a lot more to go with this speaking session. This is just the normal speaking role play. Then afterwards, I gave a general feedback, and there is a in-depth or intensive feedback coming up. We are going to have this, already it is recorded, and my artificial intelligence is typing everything. That will provide me the typed document, and that document I'll take and I'll put it on the Microsoft Word on this computer, and I'll show you what are the mistakes with red marks. I will strike them off with a red mark, and then I will push the words left or right, and then what I'll do is I'll insert new words, and I will correct the sentences with the blue mark, and then if any suggestions are there, I will insert new sentences, and if active voice is there, I'll convert into passive voice. If any personal pronouns like I, me, all these are there, I will eliminate them, and I will remove the irrelevant information by red mark, and relevant information, if anything is needed, I will use it with it. And then simple sentence, ordinary sentences are there, I make them joint sentences, like compound, complex, and simple sentences, and I'll add 2 or 3 sentences into one sentence, making it a meaningful message. That's what it is. For example, you did not take medications regularly. The recovery is slow. Due to your non-compliance with medication, expected outcomes have not been achieved. So like this, different sentences. 2 small sentences you can join with a since you are not compliant with medication regimen, since medication regimen was not taken regularly, since you did not comply with the medication. Different versions you can use. The progress was not as expected. So like these 2 sentences. Okay. Unless and until you are unless and until compliance with medication is ensured, the recovery process cannot be achieved at the earliest. So, or the recovery process will be delayed.
Yeah.
If medication compliance is not ensured, recovery process will be delayed. So like this, 2 different concepts. You are joining with unless, if, but, and like that. You were compliant with medication, and therefore the recovery process was sooner than expected. Are you able to understand, Preeti?
Yes, sir.
So we'll learn slowly we learn. We cannot, you're a small child now, you're a beginner. I cannot give you bones to chew. Okay. I cannot give meatballs. I can give you only grounded food, like Cerelac or something. Small child's food only I can give. Slowly, gradually, I'll see your growth. Okay.
Okay, sir.
So those who are interested to join the sessions, you can subscribe the course, and you can call me on +91 98 67360. That is Simon Peter, and this is Grand Master Class. Thank you very much.